Welcome back to the Deep Dive. Today we're going to be tackling something a lot of people have questions about, I think, the pelvic exam.
Yeah, a topic that can be a bit mysterious or even a little anxiety inducing.
Definitely. So to help us break it all down, we've got two really interesting sources that go beyond just like the mechanics of what happens and actually delve into the why behind each step.
And what really stood out to me from these sources was the emphasis on how the pelvic exam is really about getting a comprehensive understanding of a person's well being. It's not just a quick physical checkup.
That's interesting. See, I think a lot of us probably picture it as like a pretty quick and straightforward procedure, but it sounds like there's a lot more to it.
You're absolutely right. It actually begins with a conversation between you and your healthcare provider. That's a chance for them to understand your health history, to address any concerns you might have, and to kind of set the stage for the exam itself.
So before things even get physical, there's this opportunity to have a really open and honest dialogue with your doctor or nurse.
Exactly. And this part of the exam is so important because it allows the provider to tailor the exam to your individual needs. They might ask you about your periods, your pregnancy history, any symptoms you're experiencing, and even your emotional well-being.
Wow, I never realized they would ask about things like emotional well-being. That really highlights how this exam is about taking a holistic approach to women's health.
Absolutely. And one thing that really stood out to me from the sources was that providers might even ask patients if they feel safe at home.
That's powerful. Why would they ask about something like that during a pelvic exam?
Well, it's all about understanding the context of a person's health. For some women, going to the doctor might be one of the few times they're alone and able to speak freely about sensitive issues.
Yeah, that's a really good point. It makes you realize how crucial it is for healthcare providers to create that safe and supportive environment, where patients feel comfortable sharing that kind of information.
Exactly, and that leads us to the physical exam itself. One of the sources we looked at describes this part of the exam as being like a detective searching for clues about your health. I thought that was a helpful way to think about it.
Oh, I like that. So what are the main clues, so to speak, that the detective is looking for during the physical exam?
Well, there are three main parts to the physical exam: the external exam, the speculum exam, and the internal exam.
Okay, let's take those one by one. What happens during the external exam?
During the external exam, the doctor is visually examining your vulva. That's the area around the opening of the vagina. They're looking for any signs of irritation, infection, or anything else that seems out of the ordinary.
So they're just looking for anything that seems unusual.
Exactly. And it's really important to remember that everyone's vulva is unique, so there's a wide range of what's considered normal.
That's a really good point. A lot of people might feel self-conscious about that part of the exam, but it sounds like it's really just about making sure everything looks healthy.
Right. And if there are any concerns, the doctor can discuss those with you and figure out if they need to investigate further.
Okay, that makes sense. So the external exam is all about visual inspection. What about the speculum exam? I think that's the part that most people are curious about and maybe even a little nervous about.
It's definitely the part that gets the most attention, but it's really not as scary as it sounds. The speculum is a smooth instrument that's gently inserted into the vagina to hold the vaginal walls open.
I see. So it's like a little window that allows the doctor to see inside.
Exactly. This gives them a clear view of the cervix, which is the lower part of the uterus that connects to the vagina.
And I know people always ask about lubrication. Is that used during the speculum exam?
Yes, absolutely. Lubrication is used to make the insertion of the speculum more comfortable.
Okay, good to know. So the speculum helps the doctor visualize the cervix. What happens during the internal exam?
So during the internal exam, the doctor will insert one or two gloved fingers into your vagina, and at the same time, they'll press gently on your lower abdomen.
So they're feeling around inside.
Right. This lets them feel your cervix, uterus, and ovaries to check for any abnormalities.
What kind of abnormalities are they looking for?
They're checking for anything that feels out of the ordinary in terms of size, shape, or texture. Like, for example, they might be feeling for fibroids, which are non-cancerous growths in the uterus, or cysts, which are fluid-filled sacs that can develop on the ovaries.
Got it. So they're looking for any lumps or bumps that might be cause for concern.
Exactly. And they'll also check for any tenderness or pain because that could be a sign of inflammation or infection.
That makes sense. So the internal exam is about getting a feel for what's going on beneath the surface.
You got it. Just like with the external exam, if they find anything concerning, they'll talk to you about it and figure out the next steps.
That brings up an interesting point about communication. What if someone is feeling like really nervous or anxious during the exam? What advice do our sources have for making the experience more comfortable?
One of the biggest things is to talk to your doctor beforehand. Let them know about any anxieties you have, or if you've had a negative experience with a pelvic exam in the past.
That's a great point. It gives the doctor a chance to address those concerns and maybe even adjust the exam to make it more manageable.
Exactly. They might suggest things like using a smaller speculum, or maybe even taking some medication to help with relaxation, or having someone you trust in the room with you for support.
Oh, wow. I didn't realize medication was an option for something like this.
It can be really helpful for some people, especially those who have had traumatic experiences in the past. And like we were saying, just having a familiar face there, whether it's a partner, a friend, or even a nurse, can make a big difference in terms of feeling less alone.
Yeah, absolutely. It's all about creating that sense of safety and reassurance, which I think is so important in any medical setting, but
Mhm.
especially when it comes to something as sensitive as this.
I totally agree. And another thing that can help is to practice some relaxation techniques before the exam, like deep breathing or meditation, anything that can help you feel a little bit more grounded and in control.
I love that. It's all about finding ways to manage that anxiety and just feel more comfortable in this situation.
Exactly. And remember, it's totally normal to feel nervous or apprehensive, especially if it's your first time. The more you communicate with your doctor and advocate for your own comfort, the better the experience will be.
I think that's such an important message. It's your body. You have the right to feel comfortable and respected throughout the entire process.
Absolutely. Another thing that our sources emphasized was the importance of finding a healthcare provider that you trust and feel comfortable with. That can make a world of difference in terms of your overall experience.
Oh, I completely agree. It's so important to have that sense of trust and rapport with your doctor, especially when it comes to topics like, pelvic health.
Exactly. Don't be afraid to kind of shop around and try different providers until you find one that feels like a good fit. You deserve to have a healthcare team that you feel confident and comfortable with.
That's a great point. It's your health, and you should feel empowered to choose a provider who meets your needs and respects your preferences.
Yeah, and it's worth mentioning that some people might feel more comfortable with a female healthcare provider, and that's perfectly okay. It's all about finding someone who puts you at ease and someone who you can communicate openly with.
That's a really good reminder. It's about finding the right fit for you. And there's no right or wrong answer when it comes to choosing a healthcare provider.
Yeah.
So we talk about, open communication, finding a provider you trust. But I think a lot of people are probably still wondering, why is a pelvic exam even necessary in the first place?
Yeah.
What can it really tell us?
That's a great question, and it's one that our sources go into quite a bit of detail about. Pelvic exams are actually essential for several reasons. They can tell us a lot about our health.
Okay, so let's dive into those reasons.
One of the primary reasons doctors recommend pelvic exams is to figure out what's causing any symptoms you might be having. This could be anything from unusual discharge to heavy periods, pelvic pain, leaking urine, things like that.
So it's a way to kind of get to the bottom of what's causing the discomfort or those irregularities.
Exactly. It helps your doctor connect the dots between your symptoms and what might be going on. Like, for instance, unusual discharge could be a sign of an infection, while really heavy periods might indicate fibroids or maybe hormonal imbalances.
That makes sense. So it's not just a routine check. It's a more targeted way to figure out what's going on.
Exactly. And here's where it gets even more interesting. Pelvic exams are crucial for screening for cervical cancer.
Oh, right. I've definitely heard about that. But I'll be honest, I'm not exactly sure what that screening actually involves. Could you break that down a little bit?
Sure. So during the speculum exam, your doctor might take a small sample of cells from your cervix. This is called a pap test.
Okay, so that's what a pap test is.
Right. And that sample is sent off to a lab to be tested for any abnormal cells that could be a sign of cervical cancer. Early detection is key when it comes to cancer, and pap tests are a really big part of that.
So it's a way to catch those potential problems early on when they're most treatable.
You got it. And sometimes they'll also do an HPV test, which checks for the human papillomavirus. It's a common virus that can sometimes lead to cervical cancer.
So it's like a double check to make sure that everything's looking good.
Exactly. And it's pretty amazing how these tests can actually identify abnormalities at the cellular level even before you can see any visible changes.
That's incredible. It really shows the power of preventative care. So we've got symptom investigation and cancer screening. Are there any other reasons why a doctor might recommend a pelvic exam?
Definitely. Pelvic exams can also be used to check for sexually transmitted infections or to monitor a pregnancy and to check on the placement of an IUD that's a type of long-acting reversible contraception.
Oh, I see. So it's really a multifaceted tool for monitoring and maintaining, overall reproductive health.
You got it. And one of the biggest myths out there is that you always need a pelvic exam before starting birth control.
Right. I've heard that one too. Is that true?
Nope. In most cases, you don't need a pelvic exam before starting birth control, unless you're getting an IUD, which has to be inserted by a healthcare provider.
That's really good to know. I think that myth has probably prevented a lot of people from seeking out the contraceptive care that they need.
I agree. So, yeah, it's great to clear that up. And if you have any questions about contraception, your doctor can help you choose the best option for your situation.
I think that's a great place to wrap up this part of our deep dive. We've definitely covered a lot of ground here, from like the different parts of the exam to, the reasons why it's so important.
Definitely. And I hope we've also managed to address, some of the anxiety and misconceptions that people might have about pelvic exams. It's a routine part of healthcare for many women, and it's really nothing to be afraid of.
Absolutely. And as we've learned, it's all about open communication, feeling comfortable with your provider and understanding the valuable information that this exam can give us.
It's really interesting how much both of these sources focus on the emotional side of the pelvic exam. They really highlight the need for healthcare providers to be, you know, sensitive and create a comfortable environment.
Right. And that goes back to what we were talking about before about feeling safe and respected throughout the entire process. But, like, practically speaking, what can healthcare providers do to actually make the experience uh, less daunting for their patients?
Well, one thing the sources suggest is really encouraging patients to talk to their doctor beforehand about any concerns they might have.
Hmm.
So the doctor can address those anxieties head on and maybe think about ways to tailor the exam to that particular person.
So it's like taking a more proactive approach rather than just showing up and feeling apprehensive about what's going to happen.
Yeah, exactly. So, like, for example, if someone is particularly worried about pain, the doctor might suggest using a smaller speculum or, even prescribe something to help with relaxation.
Oh, wow. I didn't realize medication was an option.
Yeah, it can be really helpful for some people, especially those who had, traumatic experiences in the past. And along those same lines, the sources also talk about how beneficial it can be to have a support person in the room with you during the exam.
That makes a lot of sense.
Yeah.
Having a familiar face there, whether it's a partner or a friend or even just a nurse,
hmm
can definitely make you feel less alone and more supported.
Absolutely. Going through all of this information, I'm realizing there are all these nuances to the pelvic exam that I think most people probably aren't even aware of.
Right. It's definitely a lot more complex than like, a lot of people might initially assume. So what would you say are like the key takeaways here, the things our listeners should really remember about all of this?
Well, I think one of the biggest takeaways is that pelvic exams aren't just about checking for cancer, as important as that is. They're about so much more. Identifying the cause of symptoms, looking for infections, monitoring pregnancies, really just getting that overall picture of your reproductive health.
Right. That's such a good point. It really changes how we think about the purpose of this exam.
And something else we've talked about a lot, but it's worth repeating, the importance of communication. Don't be afraid to ask questions, voice your concerns, and advocate for yourself during the exam. It's your body, and you have a right to feel informed and empowered.
I couldn't agree more. That sense of empowerment is so key to having a positive experience. And also just remembering you're not alone in this. So many people feel anxious or apprehensive about this exam, but there are resources out there to support you.
For sure. And, something that wasn't really explicitly mentioned in the sources, but I was thinking about it as we were talking, the role of self-care in maintaining good pelvic health.
Oh, that's interesting. What kind of self-care practices are you thinking about?
Well, things like practicing good hygiene, wearing breathable underwear, managing stress, those can all contribute to a healthy pelvic environment.
Those are great tips.
Yeah,
It's amazing how much those everyday things can impact our overall well-being.
right. And another part of self-care that we don't always think about is advocating for your own comfort during medical procedures. It's okay to speak up if something feels uncomfortable or if you just need a break during the exam.
Yeah, that's such an important reminder. It's easy to feel like we have to just go along with whatever the doctor says,
Mm,
but we have the right to say something. We have the right to make sure that we're being treated with care and respect.
100%. One thing I was thinking about as I was reading these sources was how the experience of a pelvic exam might differ for people with different bodies and backgrounds.
Oh, that's a really good point.
Yeah.
We've been talking about this in a pretty general way, but there are so many individual factors that could make someone more or less comfortable.
Yeah. Yeah, exactly. Like for someone who's experienced sexual trauma, their concerns and anxieties are probably going to be very different from someone who hasn't had those experiences. So, healthcare providers really need to be sensitive to those individual needs and create an environment where everyone feels safe and welcomed.
Right. It all goes back to finding a provider who's not just knowledgeable, but also compassionate and understanding.
Absolutely. It's about finding someone who really listens to you, who takes your concerns seriously, and who respects your needs and preferences.
And that brings us back to communication. If you're not feeling comfortable, or if you have any specific concerns, don't be afraid to speak up and ask for what you need.
Exactly. And, sometimes that might even mean getting a second opinion. If
Yep.
you're not satisfied with the answers you're getting, or if you feel like your concerns aren't being addressed, it's totally valid to talk to another healthcare provider.
That's a really good point. I think a lot of people hesitate to get a second opinion, but at the end of the day, it's about finding the care that's right for you
Hmm.
and making sure you feel confident in the decisions you're making about your own health.
Absolutely. This reminds me of a time when I was actually feeling really anxious about a medical procedure, and I was like hesitant to speak up because I didn't want to seem difficult.
Oh, I think we've all been there. It's so easy to feel like you have to just go along with whatever the doctor says,
Yeah.
but it's important to remember that you have a voice and that your feelings are valid.
Exactly. And you know what? When I did finally speak up and share my anxieties, the doctor was so understanding. They explained everything in a way that I could understand and even adjusted the procedure to make me more comfortable.
That's so great to hear. It really shows how much of a difference open communication can make.
It really does. And it made me realize that doctors are people too, and they really do want their patients to feel comfortable and cared for.
Yeah, that's a really good point to remember. Sometimes it's easy to forget that, especially when we're feeling vulnerable. But remembering that they're human too can make us feel more comfortable, opening up and sharing those concerns.
I think that's such an important point. It speaks to the human connection in healthcare. It's not just about the technical stuff, it's about the relationship between the patient and the provider.
I totally agree. It's about feeling seen and heard and respected as a person, not just a set of symptoms or a medical chart.
Right. And when you have that connection, it can make even the most difficult medical experiences feel a little bit easier. While we're talking about feeling empowered and taking control of our health, I think it's worth remembering that sometimes the results of a pelvic exam might not be what we want to hear.
That's such an important thing to acknowledge. It can be really hard to hear that something's wrong, especially when it's related to our reproductive health.
Absolutely. And in those moments, it's so crucial to remember that you're not alone and there are resources out there to help you. Your doctor can walk you through the next steps, whether it's more testing or treatment options or even just emotional support.
It's so important to remember that there's always hope, even when things feel really challenging. And that leads me to another question. What would you say to someone who's putting off getting a pelvic exam because they're scared of what the doctor might find?
That's a really valid concern, and one that a lot of people have. I think it's important to remember that knowledge is power. The more you know about your own body, the more empowered you'll feel to make decisions about your health. And avoiding an exam out of fear isn't going to make any potential problems go away. It could actually make things worse.
Right. It's like the saying, what you don't know can't hurt you, but in this case, what you don't know actually can hurt you.
Exactly. And sometimes I think the unknown can be even scarier than the reality. Once you have the information, you can start taking steps to address any issues,
Mm-mm.
and take control of your health.
Absolutely. And it's worth saying again, you're not alone in this process. Your doctor is there to support you, to answer your questions, and to help guide you every step of the way.
100%. One thing that stood out to me from the sources was the emphasis on early detection. So many health issues, including cervical cancer, are so much easier to treat when you catch them early on.
It's so true. It's like finding a crack in a bridge before it collapses. Early intervention can make a huge difference.
Exactly. And that's why regular checkups and screenings are so important. It's not just about finding problems, it's about preventing those problems from getting bigger.
And it's not just about the physical health benefits either. Just knowing that you're taking care of your health, I think that can give you a real sense of peace of mind.
Absolutely. It's like an investment in yourself and your future well being. As we're wrapping up this part of the conversation, I keep thinking about that theme of empowerment, taking ownership of your health, being involved in your own care, and just feeling confident in the decisions that you're making.
I love that. It's about being an active participant in your healthcare, not just a passive patient.
Exactly. And that can be as simple as, asking questions or voicing concerns or getting a second opinion. It's about knowing that you have a voice and that you deserve to be heard.
I think that's such a powerful message. It really shows how transformative knowledge and self-advocacy can be when it comes to our health.
I couldn't agree more. So we've talked about a lot in this section: the emotional side of the pelvic exam, communication, self-care, support systems.
It's been a really great conversation, and I think our listeners have probably learned a lot from it. But before we wrap up the whole episode, I want to explore one more thing: the pap test itself. We mentioned it briefly before, but I think it deserves a deeper dive, especially since it's such a key part of cervical cancer screening.
I totally agree. The pap test is so important, and understanding what it is and how it works can be incredibly empowering.
Exactly. So let's zoom in on the science behind the pap test and take a closer look at this whole world of cells and early detection.
All right, let's do it. Get ready to enter the microscopic world of cervical cells.
All right, so we're going microscopic. We're going to be talking about the pap test, which, as you mentioned, is all about looking for abnormalities in those cervical cells, which could be a sign of cancer. But before we get into the details, can you just remind us, like, what exactly is the cervix and why is it so important?
Of course. So the cervix is basically the opening between the vagina and the uterus. It's a small cylindrical shaped organ kind of at the lower end of the uterus, and it's super important for, well, reproduction.
Okay, so it's like the gateway to the uterus.
Exactly. Like during your period, it allows the blood to pass through. And during childbirth, it has to dilate or open up to let the baby pass through. And because of, where it is and what it does, it's susceptible to certain changes that can sometimes become precancerous or cancerous.
So that's why it's so important to keep an eye on it, so to speak, and look for any signs of trouble.
Exactly. And that's where the pap test comes in. It basically involves collecting a small sample of cells from the surface of the cervix, and then those cells are looked at under a microscope to check for any abnormalities. It's kind of like a detective looking for clues at a crime scene, except in this case, the crime scene is the cervix, and the clues are these tiny little cells.
Okay, I can picture it. Those tiny little cells under the microscope.
Yeah,
So what are they actually looking for in those cells? What makes a cell abnormal?
that's a great question. So, normal cervical cells have a really specific look under a microscope. They're pretty uniform in size and shape, with a nice clear nucleus and a smooth outer membrane. But when cells become precancerous or cancerous, that appearance starts to change. They might get bigger, have irregular shapes, or the nucleus might look different.
So they're looking for the cells that are kind of misbehaving, so to speak.
Exactly. Those changes in how the cells look can be an early warning sign that something's not quite right. And what's so cool about the pap test is that it can actually detect these changes long before any symptoms would even show up.
That's amazing. It's like having this secret window into the cellular world where we can catch those problems super early. But what happens if the pap test does find abnormal cells? Does that automatically mean it's cancer?
Not necessarily. Abnormal cells don't always equal cancer. In fact, lots of times those abnormal cells go away on their own without any treatment at all. But if the pap test does show abnormal cells, your doctor might recommend some more testing, like a colposcopy.
Well, colposcopy, what's that?
So a colposcopy is a procedure that allows the doctor to get a much closer look at the cervix using a special magnifying instrument. It's kind of like a speculum exam, but with way more detail. And sometimes during the colposcopy, the doctor might take a small biopsy, which is just a tiny sample of tissue, and that gets looked at under a microscope as well.
So it's like a more detailed investigation to figure out what's going on with those abnormal cells.
Exactly. The results of the biopsy will tell the doctor how severe those cell changes are, and then they can recommend the best course of action.
Okay, that makes sense. So the pap test is like the first step.
Yeah.
And then if anything seems off, the colposcopy and biopsy give you a clearer picture. It's like a multi-level system for early detection.
Exactly. And it's worth saying again that regular pap tests are the most effective way to either prevent cervical cancer or detect it early when it's the most treatable.
Yeah, I think that's super important to emphasize. A lot of people are probably wondering, like, how often should you actually be getting a pap test? Is there a general guideline?
The general recommendation is to start pap tests at age 21, and then you continue getting them every 3 years until you're 65. But, depending on your health history or your family history or the results of previous pap tests, your doctor might recommend a slightly different schedule for you.
So it's always a good idea to chat with your doctor about what's best for you, individually.
Oh, yeah, absolutely. They can help you figure out your own personal risk factors and put together the right screening plan for you.
Well, this has been so informative. I feel like I have a much better grasp on this whole pap test thing, and it's really amazing to see how much it can do to protect our health.
I'm glad to hear that. I
I'm
think the more we understand the science behind these tests, the less scary they become. And it's pretty incredible how far we've come in terms of being able to detect and treat these potential problems before they even become serious issues.
Right. It really highlights the power of preventative care and early intervention. And I think it also speaks to the amazing work that healthcare providers are doing to utilize all these advancements and provide compassionate care.
Couldn't agree more. It really is a combination of the science and the people that makes it all work. And I think that's a great place to wrap things up. We've talked about a lot when it comes to pelvic exams, from, you know, the emotional stuff to the science behind it all.
Yeah, we've definitely given our listeners a lot to think about. Hopefully, we've also helped them feel more informed and confident when it comes to their own health.
Exactly. Remember, this is just the start. Keep learning, ask questions, and be an advocate for yourself. You've got this.
And if you're ever feeling lost or unsure, reach out to your healthcare provider. They're there to help you navigate it all. Well, that brings us to the end of another deep dive. We hope you found this episode helpful and empowering. Remember, knowledge is power, and when it comes to our health, being informed is key. Until next time, stay curious and keep diving.